Greetings to all PhysioTV viewers. Today we bring about another exciting talk by a noteworthy physiotherapist who's based right here in Pune. And it's a pleasure and a privilege to introduce to everyone Dr. Vijayakumar sir. Dr. Vijayakumar sir is a professor of sports physiotherapy and rehabilitation at Dr. D.Y. Patil College of Physiotherapy in Pimpri, Pune. He is also a passionate academician and researcher who has graduated from his physiotherapy from Dr. MGR University, Chennai, and also done his master's in sports physiotherapy from Alagappa University in November 2000. Sir has had a fellowship diploma in sports rehabilitation from London Academy of Sports and Health Sciences in 2015. He's had a PG diploma in on-field sports injury management. He's had a PG diploma in fitness and wellness management and an international certification in bioethics and human rights by UNESCO in 2019. Sir is presently a PhD scholar with D.Y. Patil Vidyapeeth Pune, associated with more than 9 universities as a Board of Studies member. He has had more than 24 years of teaching and clinical training experience with keen interest in research, with about 34 publications in international journals and 5 ISBN numbered books. Sir has published and granted 1 patent as prime researchers and has organized more than 30 workshops for special professional skill training. He has been invited for more than 40 conferences, national and international, and CME as a resource person and chairpersons across India. He has been invited as an official sports physiotherapist for more than 20 tournaments across India. He has received 8 awards for significant professional contribution, including the IAP Award for significant achievement in teaching, research, and sports, and the Indo-Asian Award for sports biomechanics. Sir has organized 3 national conferences and more than 20 seminars. Welcome, sir. So today, sir is going to talk on a very pertinent topic of functional assessment in knee or for knee and ankle in athletes. This is naturally a very clinically heavy topic because many of the sports physiotherapists very often wonder when the sports, I mean, we do a lot of rehabilitation to get the patient back into sports, but how do we assess whether he's really ready for it or not? And how do we conduct all these assessments to know and at what juncture or at what phase of rehabilitation should we consider doing the assessments that we hear about or we have read about in the books? So over to you, sir, and I hope you will throw enough light to educate all our PhysioTV viewers about this very important and relevant topic.
Yeah, thank you, Dr. Sharma. It was nice seeing you, and thanks to Sanchit Institute of Physiotherapy for inviting me for this short session of around 40 minutes to discuss on functional assessment for ankle knee complex. Proceeding further, we know functional assessment of knee is or knee or ankle. When we say it's a complex component, you just can't do it because when you have an individual who comes down to us for a sports injury, we are all as physios good in sports rehabilitations from phase 1 to phase 2 to phase 3 and phase 4. We all know what is the basics to be done for phase 1 and 2 and 3 and 4. But the problem that we sometimes face is how do we progress from phase 1 to 2 or 2 to 3 or 3 to 4. Now, even 1 and 2, it's okay because like by and large, they're not going to be heavy loaded activities, but it comes down to from progressing from stage 2 or phase 2 to phase 3 or phase 3 to phase 4 or getting him back to the sports. The question comes down there. Is he really fit enough for getting back to the sports? And for that, we know that we have a lot of assessments to be done, and for one of the basic and important component of this return to sports criteria is your functional assessments. Apart from a skill assessment, which the coach or probably your sport specific trainer is going to help you up with, this functional assessment is something that is very important as physios to find whether he or she who is getting rehabilitated under us is fit enough to get back to the sports. Searching down to so many areas about what functional assessment is, I couldn't probably get a clear and concrete definition to term it as, and hence probably out of my experience, I have termed functional assessment as a quantitative measure of integrated movements of the body. It's a quantitative measure of integrated movements of the body that includes range of motion, strength, stability, balance, agility, endurance, shear and stress loads on the joints and its associated structures as a whole through mental readiness. If you look into this, it's a complex component starting from a basic range of motion to strength and stability to higher components like agility, endurance, power, stress and shear loads, and without forgetting the mental readiness of it. So it's short. If you are not ready to take up those higher loads or ready to get back to the sports, you will not be able to go back to your sports in a successful manner. Right. So after knowing functional assessment next, what are we looking down for it? Because we know when we have an injury, we always make sure that the sportsman comes down to a physical therapist. Gone are those days where you have an injury, a medical team goes in for, a surgical team goes in for. Okay, those are olden days. Now it's a direct physical therapy visits, and the physical therapy starts a rehabilitation process. If the physiotherapist prefers that there is a need for a medical intervention, surgical intervention, he refers for for a physician or for a surgeon. But however, if it doesn't, a rehabilitation program is being planned and for. Now, a regular physical therapy rehabilitation is always focused on your functional life, by getting back to your ADLs as early as possible. But when you come down to sports, it's more than that. After you are functionally fit, after you get your ADLs being done, what is an advanced life that you're going to look for or getting back to your sports? So going back to your sports, getting to advanced life, active life is more than the regular physical therapy and your ADLs. And that's what we in sports therapy look in always. Next. Now, as advanced lifestyle is going down, is advanced lifestyle is there. Now, there is something that we are more focusing on. A simple walking, a simple running, or a simple jumping is not sufficient. So there is something more than that. So naturally, if something is more, it doesn't stop with one single component. It is not only related to your strength or your balance or your endurance or your power. It is an integrated component. That is why the definition was being framed as an integrated component of so many issues. Now, functional testing is one that is essential to confirm whether you are fit enough to get back to your active life, and if you're into an active life, how fit are you to progress more into that active life into your sports. Now, how did this functional testing evolve? In early 1980s, there was only clinical testings. You have an injury, you have a clinical testing being done, a sensitive is there, then probably go for rehabilitation. And in regular rehabilitations, a basic strengthening component or probably some amount of preventing component is being used in for, which is usually being done by clinicians and coaches. Thanks to evolving, I mean, exercise physiologists, where they said like, no, we had to do something more than that to check for your strength and power and so many components. And then exercise physiologists joined also in the team, and then later in the early 2000s, fitness testing came down as a combined activity of exercise physiologists, clinicians and coaches, and physiotherapists used to follow what they're being told. But as days progressed, as rehabilitation started taking a better shape, they said like, strength is fine, can be checked by a physical therapist. Power, of course, by physical therapist. Other components of agility, endurances, your fitness components. Now, they are not in the purview of those people. So, who takes care of those components? So, naturally, a physical therapist comes. So, physical therapist started taking the upper hand on evaluating the individual's fitness status, your inclusive of strength, power, range, what is essential for individual, and from basics to advanced categories of your fitness training by framing out a lot of fitness testing batteries, which emerged in probably in early 2010s, where physiotherapists started taking the lead and they started taking support from exercise physiologists, coaches, and clinicians, assessing the individual properly and giving them a right protocol, what is to be done, what is not to be done, if it can be done, how much it is supposed to be done, and how much it is not supposed to be done. So these guidelines is being always done with a functional testing. In the last almost 2 decades, it's being in very much in importance for it. Next. So strength and power. The question is that like, okay, fine. So what is the great thing in this? Like, is that if a sportsman has got a good strength, if a sportsman has got a good power, is it not sufficient enough to say that he is fit enough to go back to the sports? The answer definitely is no, because it is being included in the research that strength or your power assessment will not be sufficient enough to confirm your sporting performances. Okay, it is not now. It is almost 30 years back they have said only a strength and power assessment cannot be a component for getting back to your sporting performances. So it means that there's a lot more to be looked in for. So we have to have a discrete protocol to discriminate whether the individual is fit to move, fit to play, or fit to play a sport, or fit to play a competitive sport, or fit to play a really competitive sport of higher level for performances. So there are so many things which can be differentiated only through a functional testing components. Next. Right. So what is the need? If you look on, probably, as I said, just medically clearing somebody to tell him that you are fit enough to go back to your sport, it is absolutely irrational. Okay, maybe he is medically fit, that's all. But is he physically fit is a question. Is he functionally fit is a question. Is he is his performance fit enough to meet the demands of the particular sport? So a physician does not know about or does not directly involved into this area of performance testing, performance analysis, or whether he is fit enough to get back to his sports specific training or his sports specific rehabilitations. So those days where doctors used to inform coaches are being now replaced by physios informing coaches or physios informing your physicians or surgeons to find. Now, why these changes occurred? Because return to sports is not just a physiological component. It's a physiological component involving a mechanical component, involving probably a strength component, involving your training component. So there are a lot of involved, and a physiotherapist is involved in all these areas. A physiotherapist can probably take a better diagnosis along with a physician or a surgeon to find where he is physically fit or not fit. A physical therapist can take a decision on finding how strong is he in terms of strength or a power or an endurance. A physical therapist can find what is the movement pattern that is going to be right or wrong following an injury, which can be informed to the coach of what is not to be done, what has to be emphasized on. A physical therapist can tell a fitness trainer or a masseur what is expected from the individual during a training component regarding your strength or whatever it is. So this has changed in the recent times, and hence we say that if you are expecting a sportsman to get back to the sports, get back to a normal life, or get back to more than the normal life, because an active paced life, getting back to the sports, what the need is here is you have to assess him whether he has all the capabilities of finding himself fit to meet the demands that is being done by probably your functional assessment batteries. Next. Right. So what does literature tell about it? It's not me telling. It says almost 90% literature is only saying that, okay, you have a lot of studies on your functional assessments, getting back to your sports, but how many of them are randomized control trials? Always the question is always interesting over there. And even teachers have said that like after a lower limb injury, only half the injured athlete return to the pre-injury sport level. Mind it, only half of them reach to the pre-injury sport level, and only 15% of them get back to the competitive sports. Look at the figure. If you have 100 injured sportsmen, only 50 of them get back to the level of pre-injury status. Okay, that is between 9 months to 18 months, almost in 1.5 year. Only 50% of them get back to the pre-injury status level, and only 15 percentage, that even 15 out of 100, get back to the sports. Almost it means 85% of them are losing the sports as a career. Why? Because we don't have a strong literature to support what, when, how all these things to be done, when to introduce, when not introduce. So if we just blindly go through today's research, it just we are riding on a semi-blind horse because we don't have a strong evidence to say. Just giving you an example over here on a meta-analysis says, yeah, please the next slide. The meta-analysis says on probably searching for an article of around 3,264 articles, we could only trace 3 articles that could give us a complete data which says, and that even says there is no association between a functional performance and return to sports. So whatever guys are getting back to the sports, if you take their functional assessments, the sporting demand and the functional performances are not matching at all. But still we are getting back to the sports. Look at, out of 322, 3,226, 264 articles we have gathered in for searching, only three of them can give us a complete result. And that even they say that after we sending them back to the sports, their fitness performances and in return to the sports demand criteria does not match. So ultimately it is equal to say that the individuals whom are being trained or rehabilitated when they get back to the sports, probably none of them are being properly evaluated with the fullest possibility of identifying whether he or she is fit enough to meet the sports related demand. And that's what the scenario today is. So we say today we have a very weak area on finding out options of, okay, to say whether he is fit enough to get back to the sports specific training programs. Next. All right. But still, today in the last 1.5 decade, you could have found sports as is coming up into a greater extent thanks to the government change, the policies changes. India is leading up a lot of sports, is getting a lot of bagging a lot of medals, but injuries do happen. The question is, if an injury happens, and if within a span of time we say that this guy is particularly fit enough to go back to the field, without having an evaluation of what the standards are, if something happens on the field because of improper rehabilitation or because of non-availability of what you call his the strength and power or the fitness standards of the individual, who will be responsible? Will it be the physician or the surgeon or the coach or the athletic trainer or the physical therapist? But unfortunately, if something happens bad, it is not about who will be questioned. It's about the career of the individual who is into a sport is absolutely lost. So the question here is, who will be responsible? And irrespective of responsibility, what is the career of the individual who's found to be how injured now? So it's a big question mark. So the need is very, very, very obvious that we have to have a strict, stringent measures of finding out when and what to interpret, when and what to execute, and how to get the individual, finding him to be fit and when, and whether to say whether he's fit or not. Okay, so there is the need for your functional assessment. Right. Next. So as I said, the decision making. So what to do is a question. So decision making is now depending on us, because early 80s and 90s, it's the physicians and the surgeons and the orthopedicians. Early 2000s is the exercise physiologist and fitness trainer. In this decade, it's the physical therapist who are expected to take a decision whether to get him back to the sports or get him back to sports specific training or no. If a physical therapist takes a wrong decision, maybe whatever the result comes as will have an impact on the team, on the individual, or probably it is going to be a big issue for it. So decision making is a critical thing which is expected to be done by a physical therapist. And so you think how strong a physical therapist knowledge is expected to be when you are there on the field to take up a decision, when you are there in the team or in the squad to take a decision to find whether your sportsman is fit enough to get back to the sports, your sportsman is fit enough to get back to your fitness training, or your sportsman is fit enough to go in for a sports specific training, or your sportsman is fit enough to be included into the squad. So where is your importance? And if you do it wrong, something is going to be massively troubling the entire team. And if you're going to do it right, it is going to have a greater impact on success of the team. So decision of the physical therapy is very, very important here, and there needs the expertise of us. And it is time that we grow our expertises in this area. Next. So what are we going to do for it now? Right. So if you're looking for it, functional testing algorithm is the solution. Start examining the individual from the basics of the measurements to your strength and power testings to your functional testings. All right. Because sports specific testings are related to the sports. You take a sports of football or a basketball or probably a badminton or they have a specific sport specific testing program to find whether your skill component is fantastic. So your sport specific testing is a skill based component, whether you are fit enough to take that particular skill based component, whether you're fit enough to take that particular skill based training is the question. So there lies a functional testing component which finds whether if you pass through your functional testing component, and then probably you'll be involved or taken to the next level of your sports specific skill training or sports specific skill testing. So the algorithm is this: we as regular physical therapists, who do a basic measurements, are progressing into a strength and power measurements and testings, and then we have progressed more into a functional testing component, so that then we'll send them back to the fitness trainer or sports specific training coach for a sports specific testing set of training. So our role plays a major, has got a very crucial role to play. And if you don't play it well, probably we underestimate a good sportsman, or probably we overestimate a bad sportsman. So to identify the right sportsman, the right component of fitness, the right component of testing, and through a right component of testing and training protocol is the sole responsibility of a sports physical therapist. That's you and me who are in the field today, taking the sports further tomorrow. Next. So how do we do it? We all know. I don't say that none of us know about it. We know that there are so many tests available for functional assessments. Like you take a simple test like a hop test, testing your symmetry and your power. You have a jump power to performance test, or a single leg stance test for proprioception, test for a balance, test for dynamic balance, test for agilities like Illinois, Skoda test, and you have a so many number of tests which is being reported from 1980 to 2020. But the question is, when do we test those? When should I put my hop test into place? When should I put my single leg stands into place? When should I go for a dynamic balance test? When should I go for my Illinois test after how many weeks of injury? What is the prerequisite? Will my testing protocol have an impact on the testing itself, on the injury itself? So this question is this. So we do not know all this. We know all these tests. The question is when, which test to be informed, for whom it is applicable for, how do we interpret, and on what basis we have a criteria for clearance to say that he is fit enough to go back to the sports. So as I say, literatures are enormous, but the strength of evidence is a question mark. Next.